Whoople's cat. So this is a long video and it's a repeat video and it's on pet antibiotics. What I did was I took the two videos I did on antibiotics and I heavily edited them because they were old videos and there was a lot of editing to be done. But anyway, it'll give you an overview of my thoughts processing on antibiotics in grid down, what you should get, what you shouldn't get, what you should use for specific illnesses, as well as what to do with specific types of antibiotics. So if you haven't seen these videos before, watch them. If you have seen them before, this format is actually heavily edited, so you may actually get more out of it. Antibiotic use in grid down. If you watch this video and you take my advice and you get seriously injured or hurt, I will sue you for following my advice. Do not follow the advice of people. Get medical information and use it. There's lots of medical information available. Find it, use it, have it available in ways you can use in grid down. So, first off, bacteria are not viruses. Okay? Antibiotics do absolutely nothing to treat viruses. So flus and probably colds are not going to work with antibiotics and you shouldn't be taking them. Some types of sore throat will work with antibiotics, some types will not. Again, have a pathophysiology book available to you. Have a basic nursing care book available to you. Have a basic nursing assessment book available to you. You don't have to read them. Do not buy them new. They cost hundreds of dollars. You can get them easily available second-hand and up to 10 years behind times is fine for that type of a book. Not for the drug book though. I get a drug book that's within 2 to 3 years of the date. So you don't need 2018. Some drugs won't be in it, the ones released in 2017, but realistically speaking the information is there that you need. Don't get infected with a virus. Food and water safety, hygiene, basic stuff that will kill you if you don't pay attention to it. The only use for antibiotics in the flu is if you have a secondary infection. So using basic nursing care, you can keep people hydrated, you're going to turn them frequently, you're going to get them to sit upright at 45 degrees or more in bed, and you're going to make them cough a lot and try and clear any mucus they've got there. So hopefully you'll avoid secondary bacterial pneumonia, but you might get it. Human antibiotics are what you should store and what you should have if you wish to self-medicate and grid down. Most people can't get hold of them. Some of us can, some of us can't. If you can get hold of them, if you're going to self-medicate, keep them all in a dry, cool and dark environment. Studies show that almost all antibiotics will work at 80% efficiency for up to 10 years or more beyond their expiry date, providing the package isn't damaged and they haven't got too hot. Now there are a few antibiotics where you don't want to do that. I believe it's all of the tetracyclines. Better look it up yourself. Pet antibiotics and humans. Very popular in prepping. Very, very popular. Lots of people buying these antibiotics and they have no idea how to diagnose which to use for when or how to use them. So that's what I'm saying. If you're going to do that, take the extra step or don't bother. It really can be dangerous. I personally would use them in grid down if I couldn't get a doctor and I couldn't get human antibiotics. Gram-negative infections are more harmful than gram-positive ones and tend to be more resistant to antibiotic use. Generally speaking, you need to assume it's a gram-negative bacterial infection, and the reason for that is that generally speaking gram-negative infections will kill you, whereas gram-positive infections tend not to. Also, gram-negative infections are more common than gram-positive infections. So gram-negative is your first go-to fish antibiotic, except if the bowels or stomach have been cut open or penetrated, in which case you want to go to gram-positive absolutely immediately. If that's the case, you can try gram-positive antibiotics, bearing in mind there's going to be a problem absorbing it, bear in mind they're probably going to die, unless you can go in there and surgically repair the system, and you'll probably need IV antibiotics. But if you've got some gram-positive and you think it's safe for them to take them and they've got a penetrating wound of the bowel or stomach, you could try that. I don't think it's going to help. Now that brings in the other thing. Have you got a stethoscope? Can you listen to bowel sounds in the 4 quadrants? The 4 quadrants? Can you assess whether the belly is safe or not? Again, basic nursing care books, basic assessment books, good stuff to have. Okay, so which antibiotics are you going to use? This is the part that people don't cover in traditional prepping videos, fish antibiotics. And they really shouldn't be doing them unless, you should not be storing them unless you know which to use and when to use it. So basically, penicillin and sulfonamides are for gram positive, and streptomycin, chloramphenicol and tetracycline are basically for gram negatives. So which would you use first? If you've got somebody who's really sick, very high fever, has obvious signs of infection because they have severe rash or whatever like that, or if they have a tooth abscess, what are you going to use first? As I said, you'd use a gram negative first, unless you think it's a gram positive. So you would use a tetracycline, or I would probably not be available because they expire quickly, tetracyclines, but you might want to use chloramphenicol. Tends to be used only for eye drops. Streptomycin, fairly widely available. Anyway, treat for 1 week, 7 days, on the schedule from the drug book based upon the weight and the adult age of the patient, not necessarily what's on the label of a bottle. Because remember, you're not a fish. Treat for up to 2 weeks if it seems to be working. You have to look at the treatment regimes, at least 7 days. Some can go 5 days. Cipro is a classic one where you can take 1 dose if you've got a bad infected stomach on holiday, and it actually usually will cure it straight away. But again, we're not talking about GP tummy in grid down, we're talking about that's probably a weekly thing. If the person doesn't get well, or is getting worse, and you still want to treat them, remember, we can't treat everybody, you might want to continue the full drug regime unless they're having side effects. If the illness is side effectual, again, drug book, stop it straight away. If they're having serious side effects, stop it and start something else, either a similar type of drug or similar. Now, there are basically multiple types of antibiotic. Antibiotic is antiviral, antibacterial, and there's basically 6 types. There's the penicillins, the cephalosporins, the aminoglycosides, the tetracyclines, the macrolides, and the fluquinolones. If you're going to treat and self-medicate and grid down, I recommend you get at least 2 types of each of those. Amoxicillin. Amoxicillin treats multiple types of bacteria in different parts of the body, so it's a useful thing to have in your toolkit. It can prevent infections occurring. For example, if you have a tooth that's loose, or you knock a tooth out, or you're going to remove a tooth in grid down, you want to put them on antibiotics, and you want to put them on amoxicillin for at least 24 to 48 hours prior to the extraction of the tooth. Teeth, dental care, not my specialty, but it's an important thing. Flucloxacillin. Flucloxacillin is very good for gram positive and has very specific effects that you can use. Usually an infection of the ear, nose and throat, the infection of the blood, bones and joints, chest, gut, heart, kidneys and skin, and meningitis, and urine infections that are caused by gram positives all respond usually well to flucloxacillin. Flucloxacillin is also, I'd start with somebody who had serious burns, large scale burns in grid down. I think that's a good idea. If they have pneumonia, I would start on flucloxacillin. If they have gastroenteritis, osteomyelitis, bone infections, I would start on flucloxacillin. Cefaxillin, lungs and airway, respiratory tract, bronchitis and mild to moderate pneumonia. Skin, bone, joints, urine, genitals, gums, teeth, ear, middle ear, brain, is a good thing to start on cefaxillin. Gentamicin, most people have heard about gentamicin. Again, lungs, blood, urinary tract, good for them. Prevention of infection in eyes and ears that have been damaged. So if you scratch your eye, or if you have your ear bitten by a savage bull terrier in grid down, you might want to use gentamicin systemically, which means you eat it or inject it, or you might actually want to use it topically as well. Gentamicin eye drops, good idea to have them. Tetracycline. So tetracycline is used for bacterial infections, specifically pneumonia and any respiratory tract infection. Skin, genitals, urinary systems. Erythromycin, typically used for children. Larynx, tonsillitis, sinusitis. Carbuncles, which are a big spot, localized spots that are infected. They can be huge. Affected skin follicles, basically. Good for that. And again, surgery burns, rheumatic fever, and dental or injury. So again, you might want to put them on it prophylactically if you have to go in and cut and tidy up wounds and grit down. It's also, this is useful for people, it's good for gonorrhea and syphilis. Don't sleep around, and if you do, use precautions, use Hoople's cat condoms, but if you don't, bear that in mind. Diphtheria, which is a hugely killing disease before the advent of modern nursing, and then antibiotics, and then vaccination. But basic quarantine in modern nursing is the way to treat these infections. Scarlet fever. Azithromycin. Azithromycin, of course, all the mycins are very related to each other, right? All the acins are very related to each other. So bronchitis, again airway, again pneumonia, again sinusitis, again pharyngitis, ENT, ears, nose and throat. Ears, nose and throat. And again for chlamydia, such type of sexual disease, azithromycin. So if you find somebody grit down, comes to you and says, oh, I'm really scratchy down below, and you have a look and you think, I think they've got the clap, you might want to put on erythromycin. But if you look at them and you think it's a kind of a type of a discharge from a female who's not probably unsexually active, you might want to treat with azithromycin because it could well be fulminant chlamydia. Ciprofloxacin, again lungs, again ears and nose and throat, but specifically if it's a reoccurring ears and nose and throat, you want to switch to ciprofloxacin. Cholera. Cholera is a reasonable concern that people should have as a specific issue in grit down. And it's reasonable, I think, for everybody in North America, including far north of Canada, to assume that all water sources may be contaminated with cholera bacteria in a prolonged grit down. It doesn't take many people with cholera to spread cholera into all of the water supply. Haiti is a typical example of that. The people went there to give them aid from the United Nations, did a lot of damage to them, and they also gave them cholera, killed tens of thousands. What I recommend to treat cholera is doxycycline. But I do recommend that you look at the sites that I put up on here and go and check them out yourself. Pneumonia. A lot of the antibiotics work for respiratory infections, treat for a week with one, then add another one if you need to, do the full course of the first one and do the full course of the second, give basic nursing care and hydration. So all pneumonia that you get is community acquired pneumonia, and so the treatments for community acquired pneumonia is what you want to look up. There is ventilator acquired pneumonia, and there is also hospital acquired pneumonia. Don't bother looking at them, have no place in grit down. They're treated very differently. So when you're looking up pneumonia or you're looking up treatments because you've got a family member who's sick in hospital, bear in mind that hospital pneumonia, acquired pneumonia, and ventilatory acquired pneumonia from a ventilator to breathe for you, not totally different, but very different from regular treatment of pneumonia. Botulism, don't get it. Don't eat expired food. Microwave all of your food for an awfully long time and stir it very, very well. All food, including vegetables. Well, that's not practical. So watch the video on botulism and follow it. Follow the advice as far as you can. Botulism from food poisoning cannot be treated with antibiotics, nor even worse, should it be treated. If you have a case of botulism and you give antibiotics, what typically happens is that you kill the bacteria, the botulism bacteria. By killing them, all of the neurotoxin, which causes the signs and symptoms of botulism, is suddenly released, so you'll lose the patient. kill the disease, kill the patient. So do not give antibiotics in botulism. There's a very specific type of botulism which you will not understand what it is. That is a wound infection with botulism bacteria in it, which you can get from water and also from the environment. So you can give antibiotics for that, but frankly you won't know it's botulism anyway. But if you've got symptoms of just systemic botulism, do not ever give antibiotics, ever, if they have those signs and symptoms. You'll kill them. There's a bunch of stuff I did on Lyme disease and ticks in general as well on this, you can look at yourself in your own leisure. I have good news. Usually I don't have good news, but I have good news for you guys. Antibiotic resistance. The antibiotic resistance is now active, and there's lots of really bizarre, to me, I'm an RM, really bizarre stuff out there online and in hospitals about how antibiotics are about to end and we're all going to die. The truth is, antibiotics are not about to end, and we're not all going to die if they do end. Now, why am I saying that? The reason I'm saying that is studies have been done in Europe where they have good socialist universal health care, which every civilized country should have. And unless you're incredibly wealthy. If you're incredibly wealthy, you don't want universal health care. If you're incredibly wealthy and you don't want universal health care, you're a bit daft. Seriously. But here we go. After about 6 months, 3 to 6 months of no use of a specific type of antibiotic in a geographically large area, the antibiotic resistance falls. So in about a year after grid down, penicillin, good old penicillin, which is effectively useless because it's used in animals and everywhere else for most people these days, oral penicillin is pretty much useless, actually will be very effective again. So it's actually worth buying cheaper versions of different types of antibiotics and doing it that way. Now the other thing I'm going to mention is broad spectrum. If you see it labeled broad spectrum, it will probably say broad spectrum gram negative or broad spectrum gram positive. Actually, you want to get those. That means they're going to treat a range, multiple types of antibiotic, of bacteria, so that's kind of what you want to get. The more specific types of antibiotic will actually not be that useful unless you can diagnose and treat very specific infections. So I hope you enjoyed that. Remember, in grid down, tomorrow will always be worse than today unless you prepare. And it cost me quite a bit of money to get these antibiotics, and I actually feel I have made a good investment there. So this video will end. Hope you have a great day, and let me know what you think about pen antibiotics and treating human beings in grid down. Toodles.